Thank you, Manish. First of all, a very, very good afternoon to all of you. And I welcome you formally on behalf of QI in this training program. And I hope I am audible to all.
Yes, sir, you're audible.
Okay, fine. So today we are going to discuss healthcare quality in practice, measuring, evaluating, and improving with ISO 7101. So, introduction to ISO 7101. I hope that many times we got confused in the full form of the ISO. Can anyone can tell me the exact and correct full form of ISO? Anyone, please? So, ISO means International Organization of Standardization. So this is the non-government, non-profit organization which has been formed in 1947 on 23rd February, and presently it is existing in more than 100 countries, and more than 100 countries are member of the ISO, and presently they have developed more than 25,000 standards worldwide. And coming to the ISO 7101, this is the first international standard for quality management system specifically designed for healthcare organization by ISO. So these standards has come 2 years back, and now gradually it is gaining the popularity. And these standards, this is the one standards that which has taken input from 109 countries. And from India, Dr. B.K. Rana was the instrumental for giving his technical expertise for developing these standards. So core objective of ISO 7101 to provide timely care to the patient. Patient care should be in a safe and secure manner, and they should be provided effective and efficient patient care, and which should be equitable. Equitable means without any discrimination of caste, religion, or race, and focusing on people centered care. ISO 7101 standards provides requirement for management system for quality in healthcare organizations. So these standards or their requirement include a harmonized structure, identified core text which is applicable to any healthcare organizations, and using of common terms with core definitions, which is designed to benefit user implementing multiple ISO management system standards in their respective organization. So these standards also contains the requirement used to assess conformities. So many of you that maximum must be getting exposure of NABH, which is the means oldest accreditation body related to healthcare in India, and we are well versed their scoring. Like in that we use 0, 5, and 10. 0 means non-compliance to that standards. 5 uh, means that partially compliance, and 10 means that fully compliance. Next is, why is ISO 7101 important for healthcare organization? Means presently a lot of accreditation bodies are there which are focusing or giving that healthcare standards. For example, NABH and QI also have their hospital and healthcare standards related to the hospital, and in JCI and ISO 7101. So ISO 7101, what is different? As we know that any accreditation presently in India, it is a voluntary process. It is not mandatory. Although government had make it mandatory, because linking the business with the means performance and all with business, that you will get a extra incentive if you will get certain accreditation. So the same way 7101 is now gradually coming, and a lot of countries are going for ISO 7101 2023 standard implementation. So it's create a culture of quality starting with strong top management commitment, because as we know in any accreditation that top management commitment is mandatory. Generally quality people says that without support of top management, quality team is a bunch of jokers. And it's really, because if they will not get any support from the top management, so how standards can be implemented? It embraces a healthcare system based on people-centered care, respect, compassion, and co-production, equity, and dignity. These standards also focusing to identify and addressing risk. So means standards are gradually in their clauses. They are focusing that how to identify the risk, how to assess the risk, how to evaluate the risk, how to mitigate the risk, and how we have to do the risk management. Presently, a lot of accreditation bodies they are focusing on risk management. In fact, the JCI, which has come with the new edition, they have also included the new chapter on the risk management. It's ensure patient and workforce safety and well-being. Workforce means staff or employees. So if I say that in a one sentence that it is focusing on patient safety, staff safety, and environmental safety. So it is covering almost everything. In fact, any accreditation standards related to the hospitals, they are focusing on environmental safety, staff safety, as well as patient safety and their well-being. If you see that it's a three word, but any standards or any criteria or any clauses is not going out of these three words. If we have understood the intent of these standards, so it will only roam about the environmental safety, patient safety, or staff safety. This facilitates to control services delivery through documented process and documented information. As we know that ISO is quite strong in developing the SOPs, protocol processes. So again, standards are very much emphasizing on the documented process. They are facilitating us to create and to develop and to implement a good document. Standards monitors and evaluate clinical and non-clinical performances, because till now whatever the ISO standards has, they were not focusing on the healthcare organization. So this time these ISO 7101 is totally and purely designed for the healthcare organizations, focusing on their clinical as well as non-clinical aspects. And definitely these continually improve its processes and results in your organization. Let's look up the framework of the ISO 7101 standards. So generally in NABH, in QI, we are having a 10 chapters. So again, the same thing in ISO 7101, we also have a 10 clauses, or you can say 10 chapters. So here the terminology ISO has used on the name of chapter, clause 1, 2, 3 up to 10. So first three clauses are only focusing on the scope, that what are the scope of these standards, what are the normative references they have taken, and what are the terms and definitions they have used in the standards. So clause 1, clause 2, clause 3, it is limited only in up to one page. Then from clause 4, the all healthcare standards start. So in clause 4, practically, which is the practically the clause 1 or chapter 1. So this is focusing on the context of the organization. In context, Standards are facilitating us to understanding the organization and its context, understanding the need and expectations of various stakeholders, and determining the scope of the management system for quality in healthcare organizations, and definitely focusing on the quality management system. Clause 5 leadership. So that is like in NABH related to ROM chapter, responsibility of management, or if we take the QI standards, that is related to GAL, that is governance and leadership. So all these clauses are focusing on these standards. Next clause is planning. So in this clause 6, planning, these standards are focusing on the risk culture, risk management processes, and risk and various opportunities. Coming to the next clause, that is support. In support, these standards are focusing on competency of various staff, awareness, communication, documented information on various things, and controlling the data, audits, and other areas. In clause 8, operation, this is the very big clauses which is covering a lot of standards in operations. So it is focusing on operational planning and control, and then healthcare facility management and maintenance, then all clinical areas like waste management, biomedical waste management, handling of storage of material, medication error, infection control, and various other topics related to the clinical aspects. In clause 9, the standards are focusing on performance evaluation of all healthcare staff. It is also focusing on various healthcare quality indicators, and along with that, performing the internal audits and management review. And last clause, improvement, it is focusing on the continuous quality improvement, that how you are gaining or attaining your quality improvement in your organization. Then who is it designed for? So this can be applicable in various healthcare facilities. So ISO 7101 has been written with a focus on providing requirements for healthcare quality management. So these are the common standards. Some of the standards might be not applicable to the various things. So it is applicable on the single specialty hospital, on a multi-specialty hospital, on the various clinics, as well as some clinics or diagnostic models. So only single standards are applicable to all kind of healthcare facilities. Some of the clauses might be not applicable. So then sorry, accreditation body says that you can write that not applicable. Then next is why measuring quality matters in healthcare, right? Because we have to measure the quality and how it is matters to us. So what get measures get managed. But in healthcare, what get measures can save lives because there is no second chance. We cannot, if some patient expire, definitely we cannot revive it. Am I right? Because we are getting only one chance to save the life of the patient. And sorry, in healthcare, we don't have any second chance. So our all system and quality should be that good that we can do our best in the given circumstances. Healthcare today faces rising patient expectations because patient expectation is very high. When our patients are coming to any hospitals, they are coming with good expectations and they believe that they will get the best. Now, a lot of regulatory pressure is there from the various licensing authorities to the hospital, and demand of compliance with the regulatory bodies are increasing day by day. Workforce challenges, we are facing the qualified and experienced staff shortage in India. It may be related to nurses, paramedical staff, and all. So there is a need for safe, timely, effective, efficient, and equitable and people-centered care. So generally, poor quality leads to adverse event. If we are providing the poor quality services to the patient, definitely it will lead to adverse events happening in the organization. A lot of medication error can take place. Patient might be exposed to get a lot of hospital-acquired infections. Patient care will be delayed. Patient will be not satisfied in the organization, and there will be increased cost and reputation may be damaged. At the other hand, if we are providing the good patient care, so definitely patient will be happy and hospital will not face any kind of major issues and hospital will be in the profit. Then organizations to monitor and evaluate both clinical and non-clinical performance because both things goes hand in hand. Hospital has to strengthen their clinical as well as non-clinical services, and in the same way, ISO 7101 is focusing on the both aspects. So their core areas are on clinical outcome. Standards are focusing to monitor the clinical outcomes of the patient, like related to their mortality, related to their infections rate, like surgical site infection, CLABSI, UTI, or WAP. Patient safety indicators, they have to capture that lot of patient safety indicators, which are not limited to medication error as well as falls of the patient. Standards are also focusing on patient experience, that what kind of satisfactions or experience they are getting in the organizations, and standards are focusing for timely feedback to be taken from the patient, which should be evaluated, and proper corrective and preventive actions to be taken. And if it is important feedback, so that feedback also shared with the patient or their family. And further, process compliance. So standard is focusing on the process compliance related to protocol adherence and various SOPs or processes implementation. So these are the some benefits of systematic measurements, that if anything is there, if our systems are on place through that ISO 7101 standard implementation, so these standards will facilitate for early detection of risk and issues. And they will also facilitate that we can have a benchmarking of our some work or related to some quality indicator. Standards are focusing on accountability, that concerned stakeholder or staff, they should be accountable for their respective tasks. Resource optimization, that within the limited resources, what best can be given, and further providing the continuous quality improvement. And whatever the data is taken, that should be driven through the decision making, means evidence based approach to be followed, and it's also will improve patient outcome and safety, and definitely that will lead to the operational efficiency and cost control. Selecting the right performance indicator. Although we are well aware that there are different methodology for selecting the right performance indicator. The Nobdian model, we are all aware that it is focusing on structure, process, and outcome, which is the very old as well as till now very popular model, which is focused on structure, process, and outcome. Indicator should be specific. Should be able to measure the problem, and it should be achievable, relevant, and time bound. So that's a smart criteria. Then Rumba. Rumba, it is that terminology or these performance indicators has been defined by the ISQA, International Society of Quality Assurance. So ISQA follow the Rumba. Means your performance indicator should be relevant, understandable, that all people can understand it, measurable, it can measure the problem, and it should be beneficial for the stakeholder wherever you are implementing it, and very importantly that it should be achievable. So whatever the performance indicator we define, we design, or we implement, so they should be relevant, understandable, measurable, beneficial, or achievable. Selecting the right performance indicator. So ISO 7101 clause 9.1.2 specifically addressed healthcare quality indicators. So ISO 7101 has suggested to adopt the SMART key performance indicator, that should be specific, measurable, achievable, relevant, and time bound. So it should be focusing on clinical performances like mortality rate, infection rate, medication error rates, surgical safety checklist compliances, diagnostic accuracy, readmission rates, clinical outcome measures, as well as non-clinical performances like patient waiting area, appointment scheduling and its efficiency, equipment uptime, waste management and its effectiveness, staff turnover or absenteeism related to human resource, supply chain reliability or patient registration accuracy, etc. And further focusing on people-centered care. That means that it should be on focusing on patient satisfaction, complaint resolution time, compassion and dignity indicators, health literacy effectiveness, workforce, and well-being satisfaction of the staff. Then how to select the right performance indicator? Because sometimes it will be difficult depending on the scenario, depending on the situations, depending upon the problem, and depending on the limited staff or resources. So number one, that ISO has focusing that it should be on smart. Then what you have to do, that you have to align with your organization quality policy and objectives. So whatever key performance indicators you are putting up based on your existing problem or further improvement, it should be aligned with your quality policy and objective. And before selecting the right performance indicator, you should consider the risk. That what kind of the various risk if I will implement it, or there might be any regulatory requirement. So kindly don't touch with the regulatory requirement, because definitely we have to abide and we have to follow these regulatory requirement and patient need. Use a mix of outcome, process and structure indicator if you feel comfortable. So you can use that approach and benchmark against national international standards wherever possible. So these are the things that you can select the right performance indicator while implementing any performance indicator in your department or in your area. The next is monitoring and evaluating healthcare performance. So ISO clause 9.1 is focusing on monitoring and evaluating healthcare performance. So it's not only monitor, it's also measuring, analyzing, and evaluation. So there's supposed to be established and systematic process for defining what to monitor and how often, what kind of resources to be utilized, how to monitor it, how to analyze it, and further how frequently these should be done, and what kind of various methods we can choose. Then again, we have to analyze the trends, comparing against targets and interpreting any results and all. So all these things are focusing on monitoring and evaluating healthcare performance depending on the both as well as non-clinical data. Internal audits and feedback as improvement, because we can only improve through the internal audits. Whenever any accreditations come close to it, any inspection or assessment close to it, so we start performing a lot of internal audit. Because how you prepare your hospital? You cannot prepare the hospital or you cannot implement the efficient your policies or any key performance indicators without doing the internal audits. So this chapter 9.2 is focusing on the internal audit, and the purpose is to verify whether the quality management system conforms to ISO 7101 requirement and is effectively implemented and monitored. So the standard is also focusing on best practices, that is risk-based audit program. Competent independent auditor should be there who can do the unbiased and good audit to the department, and there's supposed to be clear audit criteria, scope, and reporting. Reporting to be done in a smart way without blaming the employees and all. And again, there also should be patient feedback to be captured and that should be analyzed. Staff feedback also to be analyzed through the internal audits, and any incident report are also to be audited for further corrective or preventive actions. In feedback loops, we have to include patient, we have to also take staff suggestions, we have to also analyze the complaints and provide valuable qualitative insights to complement quantitative indicators. So as you know that audits are not a fault finding exercise. In fact, these are the fact finding exercises. So we have to develop the strong mechanism of internal audits or internal auditors in our organization. So first of all, they're supposed to be properly trained. They should be educated how to do the audit. And definitely, gradually, everyone learns. Being a assessor, till now, we are learning whenever we go to the any assessment. No one is perfect, including me. So, but we have to believe in our team. We have to give the chance. We have to do the hand holding to our internal auditors, and gradually they will improve and they will do the good internal audits to you, which will be very beneficial for the organization. Managing non-conformities and adverse trends. So how to manage non-conformities and adverse trend? So ISO 7101 is also focusing on it, right? Other standards are not focused on it. So these standards has come up into the detail and they also educate you through these standards how to manage the non-conformities. So the process flow that identified and document non-conformities through your audits, through your incidents, or through your monitoring complaints. Then do the immediate containment. If there is any compromise to patient or staff, so kindly protect them. Then go to the root cause analysis. That what was the root cause? Why this problem happens? How I can remove the error? To focus on the root cause, you can use the 5 whys strategies or you can use the fishbone diagram to get the root cause. Then, based on the root cause, implement corrective and preventive actions. So you can terminate or remove that clause, and further you can take the preventive actions that these problems can be avoided. Then later on, evaluate effectiveness of the action. Because whatever the actions you have taken, kindly evaluate those effectiveness and you update all these problems in your risk register if required, if the problem was related to the safety or risk. So this is the SQA requirement which is coming up since third edition of SQA, as I am also SQA lead surveyor on behalf of SQA. So all organizations should have a risk register. Risk register, it is a live risk registers where you mention or you describe all kind of risk which might be take place in your hospital. So it might be happened already, or it might be means you are predicting that those kind of risk happens again. So you identified and you write their mitigation strategies as well in the risk register. So this is very important document and should be accessible to the concerned staff and should be in detail. So whenever new employees come, new safety officers come, new leadership take place, so they can go through the risk register and they can understand that my organization is exposed to what kind of risk and uh, what are the mitigation strategies which I can follow if this risk come to me or come to my organization. Then again, we have to do the trend analysis so that spot adverse patterns early while understanding the trend, that how the trend is going on in your organization. It is constant, the same trend, it is increasing or it is decreasing. Based on that, you can take that further actions. And then integrate with patient safety and risk management system. Building a culture of continual improvement, because you have to always try that constantly you build a culture of continuous quality improvement in your organizations. We always says that quality is a never ending journey. It's always motivate you, promote you, take you through the continuous quality improvement gradually day by day. So for building a good and strong culture of continual quality improvement, we should have a leadership commitment. So ISO has defined and emphasized the role and responsibilities of the top leadership in fostering a culture of safety and quality. If leadership is strong, and so definitely there will be a good building a culture of continual improvement. Then number two, staff engagement. We have to involve all kind of staff at all level in developing metrics and identifying solutions and training. So starting from security, housekeeping, then your middle staff, then you're up to consultant level, including top leadership. So those everyone's supposed to be engaged in building a culture of continuous quality improvement. Just culture, it's not a new terminology, it is existing since long, but initially ISQA has emphasized it or it on, and now ISO 7101 has also brought just culture in their standards. So just culture means promoting the fearless environment among staff for giving the feedback or working environment. Means we have to create a fearless environment among our staff, so without any fear, without any pressure, they can share their feelings or they can share their ideas or they can fearlessly speak about in the favor of the organization. Transparency, we have to maintain proper transparency, so we have to promote openly discussing failures as learning opportunities rather than focusing on blame. So transparency, everyone should come forward. They have to discuss and they have to not put a blame game on others. Recognitions. So while which staff are doing a good job or which departments are doing a good job, time to time we have to recognize their initiatives and we have to award them. That may be organization's methodology, that how to recognize the quality initiatives of the staff. Then again, integration of quality into daily operation. So we have to integrate whatever the good work we are doing, we have to integrate in our day-to-day operations, and it should be uniform for all the days, all the years. Not that next month my assessment is due, let's gear up. Let's prepare for the assessment because assessors are coming. Oh, this time I came to know very strict assessor is coming. So please don't do like that. You have to always maintain an integration of quality into daily operation on day-to-day basis. Then this is PDSA. That is the Plan Do Study Act. Please don't get confused. It is not any kind of act like PCPNDT or Air and Water Act. This is Plan, Do, Study Act, which ISO 7101 is suggesting. So plan, identify the problem. So first you have to identify the problem. What is the problem there? And plan a small scale changes after discussing with the various stakeholders. So you identify the problem, do the root cause analysis, discuss with the team or user department or other stakeholder. Then you are in the position to suggest a small scale change. Once you have taken that decision, then do implement the change on a trial basis. Don't force that this is the law and this will come. So you have to implement these change on the trial basis, that let's run these changes into the pilot phase for a week time, for a 10 days, for a 1 month, and then we take out a final call. Then study. You have taken a trial, you have run your pilot project, then use performances indicator to analyze the result and see if the change is worked or not. So based on that, you should take a final call that's coming into the study. Then last is act, means if successful, so you have to act, you have to finalize your things and standardize the change. If not, adjust the plan and repeat the cycle again. So this is the PDSA cycle, which ISO 7101 is focusing to implement it and to act accordingly. Conclusion and next steps. So in summary, ISO 7101 provides the roadmap, data-driven measurement, and a culture of continuous learning. Call to action, you can plan a pilot project using the PDSA cycle to address one high priority performance indicator in your organizations or in your department. So these are the key takeaways. This is my last slide. So ISO 7101 provides a structured framework for healthcare quality management. So standards are applicable for a different kind of healthcare facilities. So these are also facilitating us to measuring performance, which is essential for informed evidence-based decision making and accountability. Effective indicators. So we can use SMART here as per the recommendation of ISO 7101 and continuous monitoring feedbacks and audits, which help us identify gaps, reducing risk, and drive quality improvements. Root cause analysis should take place. Then based on the root cause, you should initiate your corrective as well as preventive actions. Leadership commitment is pioneer, staff to be engaged, transparency to be maintained, and recognitions, drive, and culture of continuous quality improvement to be maintained in the organization. And a just culture methodology to be implemented, which encourages open feedback and learning without any blame. And definitely, please follow the Plan, Do, Study Act, which drives continuity, continuous data-based improvement. So, thank you so much for your time and for your patience. And if you have any questions or any feedback, any clarifications, any inputs, please share. Thank you so much again. Thank you, Manish.
Thank you so much, sir. So we may proceed with our next session on QI accreditation process. So I request my colleague, Ms. Chanvi, we may continue with the accreditation process of QI.
Is my screen visible?
Yes, Ms. Chanvi.
Yes, it is visible.
Thank you, sir, for that insightful session. So moving forward with QAI accreditation standards for 7101, that is QAI 7101 plus. So for QA accreditation process, CHSC, the interested organization has to first do a self-assessment based on the self-assessment toolkit provided to them by the Secretariat. So after that, the application along with the self-assessment toolkit, the documents and the fees is reviewed, registered, acknowledged by the Secretariat. There is a thorough document review. The organization, if they wish to do so, can opt for a pre-assessment, that is an option that can be done both on-site, remote, hybrid, whatever is the organization comfortable to do so. Then a on-site, remote, or hybrid assessment is done for the organization. There are report reviews that includes the scoring of and any non-compliances that are raised. Now, if the organization meets the scoring requirement and submits the required corrective actions for the non-compliances, if there are any raised, they are reviewed both by the Secretariat, the assessors, as well as the accreditation committee. The accreditation committee validates the scores, accepts the corrective actions, and does a thorough review of the whole process. And if the accreditation committee is satisfied with it, the accreditation certificate is issued to the organization, which has a validity of 3 years. Now, after that, there is a process of surveillance that after 15 to 18 months of accreditation, from the date of accreditation, the organization has to go through a surveillance assessment, which can be again on-site, remote, or hybrid. And 6 months before the expiry of the application, the organization has to go for a renewal. Now, what are the benefits of this accreditation process? For patients, it is enhanced patient safety and trust. That ensures that the procedures are done correctly, they are qualified professionals, transparent. C is maintained for healthcare facilities. It enables the organizations to demonstrate commitment to patient care. It assures the community about the quality of services, demonstrating that healthcare facility is transparent and ethical manner, and potential mechanism of risk management and safeguarding for any potential legal liabilities. It is a process to stimulate continuous improvement and a mechanism of self-regulations, and also to provide an opportunity for benchmarking by comparing their outcomes with other accredited facilities. Now, for the staff of the healthcare facilities, it provides an opportunity at all the levels in the professional development. There is a higher staff satisfaction because of the good working environment, leadership opportunities, and ownership to the process. And there is a robust documentation and procedures are in place that supports in staff building their confidence to deliver proper care. Now, for third parties, it provides an objective system of evaluation and empanelment by third parties like insurance companies, other payers, government, etc. And it helps in access to reliable and documented information on facilities, infrastructure, services, and level of care. Now, the objective of these standards is to provide a framework for quality assurance and quality improvement, focus on patient safety and quality of patient care, set standards for quality and safety that organizations must achieve, and to be revised periodically and raise the bar. It is also an international recognition for the organizations who are accredited by these standards. So for QAI 7101 standard, there are 9 clauses and 34 subclauses. The scope is as per ISO 7101 with the normative reference as per ISO 7101, and the terms of definition is also as per 7101. Now, what are the supports available by QAI? We provide training on the accreditation standards. There is internal audit program by QAI. There is self-assessment available and Dive. Thank you. The interested candidates can visit our website or also give us a query on our info mail ID if they're interested for this particular accreditation process.
Thank you, Ms. Chandni, for briefing our QA accreditation process. We are now open for your query and doubts. So if you people have any query and doubts from the standard or from the QA accreditation process, you may still ask. You may unmute yourself also, or you may drop your query into the chat box also. Meantime, we can also have group photograph. I request everyone to please switch on your camera. We can have one group photograph. Those who are comfortable to open their screen, they may open their camera so that we can have one group photograph.